Okay, so with Tai Yin Yangming, I just will do it again. We treat everything between two spleen branches. So we called it wide treatment, wide front. With any respiratory, with any digestive, with any problems on the front, you can try and do Tai Yin Yangming. Works brilliantly. The only thing you have to change, points. For asthma, for example, which points we will choose for asthma? In the lung meridian, that will be points below lung 7, where lungs are. Lung 7 and down, Ashi. This is arm, in. Large intestine, below large intestine 6, Ashi, all Ashi. In stomach, below 37, 38, down. In spleen, Ashi around spleen 8.5, down. Somewhere there. All Ashi points, not just only one needle. 1, 2, 3, 4, 5, 6. You can put as many needles as you want, but don't put too many, because we have to focus our treatment on certain particular area. 2 criteria must be satisfied: dynamic balance and static balance. So this sequence Yangming, Yang Yin, Yang Yin, or Yin Yang Yin Yang is very important. And also the structure. Remember the structure? Very stable. What else can we think about? Imagine the pain around the eye, pain around the eye. Which meridian goes through the eye? If we speak about eye pain, pain in the eyes, vision, we don't think about the organ, liver. Does liver meridian go through the eye? No. So the eye does not belong to liver meridian, but the eye, why we speak about the liver? Because there is a GB, and liver will balance gallbladder. The liver meridian doesn't go through the eye. So if the problems are with eyes, which meridian goes through the eye? Stomach. It's a stomach. For example, allergy. This is the stomach meridian. Can we treat the allergy with Tai Yin Yangming pattern? Yes, we can, but there is a better treatment for this. Imagine you have a patient. She has the same allergy, but all the pulses are viral. She has allergic cold. All the pulses are viral. And when you come to left guan, let's put this as right, and this will be left. You will see that left guan, which is liver gallbladder, is either slightly pounding or very, very violent. Possibly all pulses are violent. So you can think about the liver, about the wind. So we have respiratory allergy plus digestive. Which channels are we thinking about? We think about Yangming, so large intestine and stomach, and all the pulses are viral. We think about the liver, but the liver, because it's Yang, Yin, Yang, it will go to the Yin corner. let's think about the connections between the channels, how they are related, how they balance each other. Do large intestine balance stomach? Yes, of course, this is Yangming channel, system 1. Does stomach balance liver? Liver balances stomach. Is there any connection between liver and stomach? No. There is no connection between liver and stomach, but there is connection between large intestine and liver because of system 2. This is system 1 and this is system 2. So we need another channel which will be here. I think the structure will be like this because this is the only possible structure that we might have. We need the hand yin channel which will balance stomach and liver. You're right. This is pericardium. So we have another structure which has a perfect balance, and that is a B structure which will take care of any digestion disorder but with the presence of wind, which is Jue Yin. So this pattern is called Jue Yin, Yangming. So this pattern is related to those disorders, what? Digestive, with the presence of wind or liver. The typical picture is the girl or someone who is stressed. The channels are tight. So the pulse will be either tight or very wiry, or the liver will be pounding slightly. It's a sign of GB. And also they have a digestive stuff to check. Or it can be just a simple allergy, hay fever for example. So this is the perfect way to deal with. So for example, how to recognize this pattern from the description, from the psychological portrait. These people are very sensitive, quite sensitive. Their sleeping pattern is waking up and sleep again. So they may wake up a few times during the night. They are kind of prone to have allergic reactions, and when you see their ear in this zone, you may see some redness, just some redness, not as red as I draw. This redness will say about the predisposition to the allergy. So they might have some allergy. They not might, they will have some allergy. Maybe just only spring allergy, but allergic reaction. Some liver signs.